Welcome to Talking Turkey. Today our invited guest is U.S. Senator Bernard Sanders, independent, and author of this political memoir, Outsider in the House. Our topic is health care. And first, let me declare my biases. I voted for Senator Sanders. I voted for President Obama. I support universal health care, and I'm not trying to kill President Obama's health care bill, but I'm not sure it wouldn't have killed me last year. Now, my friends tell me that attitude makes me sound like a Republican. I haven't voted Republican in 40 years. I'm an independent as far as I'm concerned. But I'm trying to figure out this healthcare situation, and it's more confusing than the average person can deal with. I've been studying it all summer. I have a few academic degrees, and I can't figure it out. Bill Moyers on Bill Moyers' Journal says he can't figure it out. I've watched Charlie Rose. I've watched the Sunday talk shows. I've read the New York Times. I've listened to the pundits. And nobody seems to be able to make sense of this health care bill. But I'm concerned about a few things, and that's why we've asked Senator Sanders to help us understand the situation a little bit better. Until last December, I had no opinion about health care. I had never taken a sick day in 22 years. And suddenly, I found myself in the hospital with half of my kidney being removed and half of a rib for a cancerous tumor. And I know for certain that if my Blue Cross Blue Shield had not allowed me to skip over my primary care physician and go directly to a specialist, that I'd be dead today. And I know for certain that if my Blue Cross Blue Shield plan had not allowed me to have duplicate tests, I'd be dead today. My surgeon said if this tumor had not been caught in time, if it had spread to the bone, that I have to tell my patients when that happens, they have 6 months to live. Well, that was 8 months ago, and I'm happy to be here with you today. We invited Senator Sanders to be interviewed, and his executive assistant and Vermont scheduler sent this reply. I can certainly understand that after an experience such as yours, you are very passionate about this issue and want to ensure that the right reforms are made to correct these issues. However, Senator Sanders is not available for interviews. Not available for interviews? That sounds like Louis XIV, not the Bernie Sanders I voted for. We will go ahead with the program anyway. We have placed a sandbag in Senator Sanders' chair, and we will ask the sandbag questions. The same questions we would have asked Senator Sanders. Welcome to the program, Senator Sanders.
Senator Sanders is not available for interviews.
Let's talk turkey. President Obama's health care plan would not allow me to skip over my primary care physician and go directly to a specialist. It would not allow me to have duplicate tests. And it was only on the third test that my tumor on the right kidney was found. Senator Sanders, does it bother you that I would be dead or dying? One of your constituents, someone who voted for you, I would be dead or dying if I had President Obama's health care plan last December.
Senator Sanders is not available for interviews.
Isn't President Obama's health care plan robbing Peter to pay Paul? Isn't it taking away the benefits of the average American and reducing those benefits so that everybody can have universal coverage with reduced benefits? As one pundit called it on Meet the Press the other day, isn't it reallocating health rather than reallocating wealth, Senator Sanders?
Senator Sanders is not available for interviews.
Look, I don't have a Cadillac plan. I have a Chevy Impala plan. I show my Blue Cross card, I pay $15 copay at the desk, and I get to see the doctor. If I need tests, the Blue Cross plan pays for the tests. But according to a July 27th New York Times article, the two plans now moving through Congress, through the House and through the Senate, would make individuals pay a $5,000 deductible and families a $10,000 deductible. That isn't a Chevy Impala plan. That's a clunker plan, pure and simple. Senator Sanders, would you buy insurance for your car if it had a $5,000 to $10,000 deductible? And if you wouldn't, why would you buy it for your own life?
Senator Sanders is not available for interviews.
Look, I don't have $5,000 deductible every year to fork out. This isn't insurance, it's assurance. Assurance that your wallet will be empty. Assurance that your bank book will be empty. If that had happened to me last year, I never would have had the second test, which cost about $1,500, I think, and which my Blue Cross Blue Shield paid for. And I would, at this very moment, have cancer spreading through my bones. Isn't President Obama's health care plan really a death sentence to people like me who don't have $5,000 to $10,000 deductible, Senator Sanders?
Senator Sanders is not available for interviews.
Well, if you can't tell me how it isn't a death sentence, would you please take my questions to the White House and ask David Axelrod or Rahm Emanuel or President Obama himself? You are my elected senator. I voted for you. These are important questions. We're not talking about a dent in a car here. We're talking about human life, flesh and blood. I'd like some answers. Will you get me the answers from the White House, Senator Sanders?
Senator Sanders is not available for interviews.
Let's try a different tack. President Obama says, if you like your present health care plan, you can keep it. Isn't that deceptive? If the government creates a cheaper plan, a less expensive plan with fewer benefits, and a $5,000 to $10,000 deductible, and my employer thinks, hey, I can save money by going to this plan, and they go to that plan, then I can't keep my other plan unless I pay huge amounts myself. I've got to go where my employer goes.